morning. Hello, ma'am. My name is Cheryl Spencer. I'm going to be a nurse today. First thing, I just need to do what we call patient identification. I told you who I am, and I'd like you to tell me who you are. First thing, could you please tell me your full name, please? I'm just going to double check that with your name band. Oh, it's on the other side. Let's see. I could see that. And could you also tell me your date of birth? Excellent. You're an Aries. Awesome. Both match. So what I plan to do now is I'm going to do what we call a simple dressing. It's this dressing that's on your abdomen from the surgery you had yesterday. How's your pain today? Manageable. Okay, that's great. So I'm just going to go get my supplies and I'll come back and I'll change the simple dressing. Okay? I'll be right back. I'm not going too far, but your call bell is right here. Hello, I'm back. I have my supplies. I'm going to get everything together, and then we're going to do this dressing as we talked about. Let me just hand sanitize again. Okay? All right, so I'm going to get this. Let me just get my stuff together. I'm going to put a bag right on the side for my dressing. First thing I'm going to do, ma'am, I'm going to take a look at your old dressing. So I'm just going to expose your abdominal area, the place where the dressing is. That's all we need to expose. And let's see, I'm going to raise this up just a little bit more just for my posture. It's good to protect your back. Okay, excellent. Okay, so I'm just going to move this. Let me just take this rail down as well since I'm over here. I'm only exposing here. All right, oh, okay, looks like it's coming off a bit. Let's take this tape off. Okay. Wow, the incision looks good. Nice and together. Nothing's popping out. A little bit of red on the dressing. This is what we call sanguineous. It's bloody and it's expected because you just had surgery. Let me just put this in my bag. I'm going to take off my gloves. We call it glove to glove and skin to skin. It's a nursing, healthcare, medical thing. Okay, let me just hand sanitize one more time. Now I'm going to get my sterile dressing together. This is what's going to be left on your dressing. Put my tape over there. Okay, this one fell out. I'm going to get another one. I did bring an extra one, so I don't like that one. I do have an extra one, and that's a good thing. I'm going to go a little bit slower this time. Excellent. So good. 4 by 4. This is my sterile glove. I don't use this part. I'll put this aside. Open. So far, so good? Great. Doesn't have to be pretty, just sterile. Okay, so I'm going to work with my fingers despite that they're not pretty. I'm going to take the first gauze. I think I could do them, and I'm going to just drop it right over your incision. I'm going to take the next one, drop it over your incision. Now I'm going to take this, what we call an abdominal binder, and I'm also going to drop this right over your incision. Awesome. Now everything's covered. Now I prefer to use the tape without the gloves. So I'm going to take these off again, glove to glove, skin to skin. Put that there. I'm going to put a small amount of tape on your skin. I don't want too much to be there. How are we doing so far? Great. That's okay. Okay, and that, ma'am, our dressing is complete. Our simple sterile dressing is complete. Last thing I'm going to do before I leave, I'm going to take my pen. I'm going to put today's date and time and initial, so my colleagues who come after me, I'm going to put it near the end of the tape. They will know the time that this was done. Okay? Your doctor orders for this to be done once a shift because we expect some sanguineous drainage. Thank you so much. Okay? I'm going to leave now. I'm going to leave your call bell here if you need anything. And you said the pain was manageable before. If you feel that it's not manageable, please call somebody, okay? You have a good day. I'll talk to you later. I'm going to put my bell back up and move my bed back. All right? Have a good day.